There are three kinds of veins in the legs: superficial veins under the skin, the deep veins under the muscles, and the veins that connect the superficial and the deep veins called connecting veins, perforating veins or perforators. The blood flows into the deep veins from the superficial veins, and at the groin the main femoral vein receives all the blood and passes on to the iliac veins and onwards to the inferior vena cava that is finally connected to the right side of the heart. There are multiple one-way valves inside the lumen of the veins. When these valves are damaged or the veins are stretched out, these valves become incompetent and the blood can leak downwards. This is called venous insufficiency. This can lead to swelling of the legs called edema, and the patient will start complaining of heaviness, tiredness, pain, itching, burning or restless legs, and many will develop varicose veins which are under the skin, or spider veins that are new growth of very small veins in the skin. Patient can develop ulcers in the skin or bleeding from these veins. You will now see the valve at the upper end of the great saphenous vein, opening and closing, to allow the blood to flow upwards towards the heart and not allowing it to leak downward due to the pull exerted by the gravity. Scenario 1. When the valve becomes incompetent, in other words it starts to leak, it allows the blood to flow in the wrong direction downwards. The blood then re-enters the deep veins through the perforating veins. This causes enlargement of the deep veins, which in turn causes the deep valves to become incompetent. Because of the large amount of blood leaking downward, very high pressure is built up in the soft tissues of the legs. Over a period of months and years, this causes the formation of spider vein and also varicose veins. The vein area surrounding the defective valve begins to stretch and expand, allowing for more blood to flow in the wrong direction, thus bringing more blood into the spider veins, causing them to grow even larger. Scenario 2. In this scenario, there are pre-existing or untreated spider veins. These veins are receiving blood from the deep veins and over a period of time start to require more and more blood flow. This excess overflow of blood goes back into the superficial and deep veins in ever-increasing volumes, and thus enlarging these veins, which eventually start to stretch and cause the valves to become incompetent. The vein area surrounding the defective valves begin to stretch and expand, allowing for more blood to flow in the wrong direction, thus bringing more blood into the spider veins, causing them to grow even larger. You are now seeing scenario 3. In this case, there are clusters of spider veins on the legs and incompetent valves in the larger vein, which have been left untreated. When the spider veins and the associated incompetent valves are left untreated, the long-lasting and excessive blood flow leaking downwards significantly increases the likelihood of a blood clot forming in the deep veins of the legs. When enough pressure builds up behind the blood clot, it will shoot up into the lung. You can see a large clot moving up through the large veins and blocking the blood flow into the entire right lung. This blood clot is called pulmonary embolism, which causes a large portion of the lung to die. A pulmonary embolism is a life-threatening condition.